Hey guys, I'm here with the boss, Miss Stephanie over here. I stopped her literally and asked her to share an important story, a very insightful story. So this is off the cuff. So, all right, you've been practicing a lot of years, right?
Mm-hmm.
What is,
Even though I'm only 21.
you're only 21, so you've been practicing for 12 years. If you if you could take all those years of experience practicing, what's the one thing that you would have liked to know or listen to earlier on in your career?
So I wish early in my career I had a better sense of tissue healing guidelines and how that relates to recommendations for clients and athletes as they're getting back into their sports and exactly how that applies to real life. I was not as confident in my early years delivering that message to my clients and giving them, the exact guidelines and foreseeing the future. And I actually have two.
All right, let's do it.
The other one is also how to deal with chronic clients. Like you can throw everything you have, chronic pain clients, I'm sorry. You can throw every single technique you have in the book, and there's just some people that, whether it's a torn labrum in their shoulder that they don't want to get surgery on, or something that just is not going to heal, and you hit a plateau, like how to help them get back to life when a plateau is hit and they don't want to move on forward with surgery. Those are the two big things that, out of looking back in all my years, those are the tough cases I wish I had a little bit more guidance with.
Those are my favorite. They're my absolute favorite, those tough ones. Mine would be, there's two. Number one would be body mechanics. I feel like I was young. I'm 21 as well. But I really feel like I should have paid attention to my hands, to my back, and all those things.
To save yourself.
To save myself. I wish I would have known that. Or actually, I would have paid attention, because people told me, it was not until I started working with massage therapists that I actually started learning or paying attention to wow, they can last all day with their hands and thumbs. And they're like, no, it's just leverage, just techniques. So I wish I would have done that. Number two is I wish somebody would have reminded me of what I do for people. As a clinician, I always thought I was removing pain and helping their knee or whatever it is. And I felt like once I figured out that I'm really trying to help somebody do something bigger, I actually asked better questions. I understood what I was doing for them in the grand scheme of their whole life, trying to give them their life back. And I stopped treating people as a body part and I treated them as a human. And that's when my outcomes got the best. And even to this day, I'm always refining, but I think that if I understood what I was doing for people, that would have helped. And number two, my mechanics. So there you have it. I hope that helps all the new grads, the students, or the veterans. If you're like, oh my gosh, so true. Awesome. Let us know in the comments. But there you go. There's our tidbits and helpful information.